On December 1st, all of the members of the House of Commons passed a motion to support thalidomide survivors. It was a joyous moment for them, but it's not the end of their political struggle. Chris Holz is an advisor on the Right the Wrong campaign, and he joins me now to discuss what are the next steps. So Chris, can you tell me what exactly the survivors are seeking from the government?
We seek a few things. First of all, that each survivor would receive a lump sum payment of $250,000. This is to deal with their immediate needs as they have aged considerably over the last several years. We also are seeking annual payments. On average, is $100,000, tax-free. And this is to go towards some of the key challenges that these folks have faced for so many years.
And there's an emergency fund that you're also asking for?
That's right. For some people, because they've used their bodies in extraordinary ways to live as normal life as they can, in many cases they've used their teeth to be able to do the most basic tasks that we are, who are able-bodied, have been so accustomed to. We're looking also at an annual fund of $500,000 so that they can deal with the additional needs that we know will come in the future. And for some of them, it may be dental surgery, which can be extraordinarily expensive.
Now, this obviously is a huge amount of money for the survivors themselves. Can you put it into perspective, though, how much this is costing the government to fund?
In Canada, it costs somewhere between $120,000 to $150,000 to incarcerate somebody. What we're looking for is the basic level of funding that these people can have a normal, decent life for the rest of their lives. And after 53 years, these people deserve it now.
So how quickly do you expect a deal to be reached?
We've challenged the government to reach a conclusion with us by January the 26th, when the House is scheduled to return in Ottawa.
So you say that this deal can be reached in 8 weeks, but do you expect any delays? How have the talks been going so far?
A lot has happened in the last 2 days. We had a very good discussion with Health Canada officials, and certainly after 8 months of waiting, we've had a meeting with Minister Ambrose. But we don't expect any delays, and I'm not sure how they could be justified publicly.
Now, money is one thing, but how important is an apology to these people?
At the end of the day, quite frankly, money to be able to get the services and the supports that they need to live the rest of their lives is the most important thing. An apology, I think, is a moral issue, but if it delays getting the funding that these people need by 1 day, then the answer is an apology is really a secondary issue.